Can you read our eyes?
Not right now. Yes. Go ahead. Okay, she was asking what was the color has a conflict. Yeah, it doesn't. It's just what we're looking is for the signs. Okay, and that could be something from a family. I don't bug into that. Okay, the question was if you have that kind of coloring in the iris, if that's some kind of problem. No. What I will look at is, I will look at it, and I'm just trying to recall the iris of somebody that you know, is that if there's some kind of not even part on the part of the stomach area that it's around the pupil, if that part is closed, for example, okay, around the pupil, if this is a stomach area, so if it's really close like that, that person has to be suffering from some kind of constipation or it's not pooping correctly. And if it's not even, this is the ideal part of the stomach. Okay, it's a little bit open. You're going like 1 or 2 times a day to the bathroom, But it could be uneven. It could be like this on this side, and the other side it could be like that, like a sort of flower. Sometimes I just concentrate on old people and try to see if that's related with some of the disease they have, if they have something with their colon, and I just ask them, if it's not even in that part. Okay.
I know you said the iris doesn't matter in terms of color. What does it mean if the iris actually changes color? And can you please say the name of the lady that has the online course?
Yeah, it's the same. I don't know the. She's asking about if the colors are very important in the iris. Not really. It's not important. Then the name of the person is Jens. It's the daughter. I don't know the name of the daughter's name, but she has a full course, $2,000 something or $3,000. Very good. She will sell you the machine, so you could also see the iris in a larger scale. I don't try to charge a lot. Okay, there's people that charge $100, and they'll give you the photo, and they will give you all the tools of it. And there's even a program, I think it costs like $10,000 or $12,000, that it will give you, they will project the iris, and it will tell you the findings next to it. So that could be great. But I try to do it as simple as possible because of this. Because there have been a lot of people getting in trouble with the law. And the wrong thing that people are doing when they do iridology is saying that you are sick, you have the disease in your liver. You can't say that. You have to confirm your things, You have to see if the person really is under hypnosis. Let's put it like that. Okay, in our terms. Another cuestión, otra pregunta. Okay. It's a very interesting science. I think you should try to integrate. The main reason I wrote a book that says 2001 hypnosis is because I think we're supposed to go on, learn a lot of things. Why? Because we are like the last resort, tapping, we have to do all that kind of thing because most of the time you are the last person, that you probably can help them fix things. You're like the guru in this stuff. So, and I do other modalities. I recommend some basic vitamins, and then I try to have a nice rapport with the medical field so they could refer me, and I go back and forth with them. It's wonderful, and they give you more trust in what you're doing when you do this kind of things. So, do you have another question besides what we're talking? This is This is a very good tool. This is a very good tool. You'll probably see changes. That's the reason I'm assigning you guys to see at least 10 people a week. The 5, you don't have to be very strict. I give you this assignment also, if you can. It's wonderful. Take a born child and look at the iris. You're going to see those fibers perfectly. Perfectly. And then when you see them growing up, 12, 13, 14, they're not perfect, but they're better than our iris, okay? You see the changes of health right there. And if somebody's doing iridology and that person is a patient of yours and you want to see some change, you will basically see it in 6 months. Now, you could also, if you learn how to do, if you know how to see the red veins, that could go away from the eyes in a matter of 2 months. It's easier. But you could find all that in the internet. You could download it, and it's wonderful.
Why is it that some people wake up and they have a bloody white of their eyes?
I don't know. I really don't know. Most of the time, I think, it's my belief. Why do people have bloody eyes in their eyes? How many minutes I have? One? It's probably it's about the food that they ate before. Most of the time, that's happened. It's just like you feel like sluggish and stuff like that. When you wake up, you ate a chunk of meat or red meat. In my case, according to my blood type, I can eat red meat, but in little quantities. Just don't be. Thank you. Don't be so gobbling. Yes.
Do you prefer?
Let me take him first, please.
Sure.
Okay. Thank you.
There's something that looks like a backbone.
Yeah, the spine. That's spine. He's asking, there's something on the map that looks like a backbone. That's the spine of the person, okay?
Do you prefer when you start looking at the eye, right eye, left eye, or it doesn't matter?
It doesn't matter. She's asking if I have a preference of looking the right eyes. But most of the time I do look the left eye first,
Okay.
the one that is right here, and then I look at the other one. So another question. This is a great tool also. If you see the part of I call the symbol of the nerves around here, you could also use that. If you have like a double, you could tell him in hypnosis, he could try to relax that part of the body more. And then that will help you go better into trance. I also use that, Can you please relax that part of the body first? Like Dolly was telling me, do you give me permission? Do you give yourself permission to relax that part of the body? Well, that's it. I mean, there's another question. You haven't? It's okay? Everything is okay? Remember to always try to confirm the thing. Yeah, the last one.
I actually know nothing about iridology, so could you tell me how, are you supposed to be in a more dark room, light room? Do you use a pin light?
Yeah, she says that I used to, she doesn't know nothing about iridology or something like that. I just use a pen light, but you could be more sophisticated. There are cameras that change the color of your iris and things like that. This is what I carry with. Okay, what is that? Probably costs $1. And if you're in the flea market, for $1, but this is what I basically use, a little pen light. Now, there's a lot of sophisticated things around there. I just, I don't want you to do what a lot of people do. They come out and they try to buy big quantities of big equipment and things like that. If you already have the practice, it's going well for you, buy whatever you want, however you feel. Go whatever training you need. Okay? Well, thank you.
On behalf of Mid-America Hypnosis Conference, I'd like to present you with this certificate And thank you for a wonderfully enlightening presentation.
Thank you, Lisa. Gracias.